introduce you to Patricia. She has been a member of Club Camembert, and I don't know if you are familiar with what Patricia does. And Patricia, you will correct me if I lie.
Sure.
She is, of course, native French, and she teaches in French. Patricia, you teach English, right?
Yes, that's right. In
But
a
you
middle
only
school.
teach English. You don't teach
Yes.
French as well.
No,
Okay.
English.
You're an English teacher to French students
That's
in
right.
Nice. You
Yes.
live in Nice. And as a side gig, she does tours where she is helping people learn French. She does interesting tours like olive factories and cooking classes and all that. But the thing that I find really interesting that might be helpful for people who are new arrivals is that she will help you. She will be a middleman if you ever need help translating. So let's say that you've just arrived in Nice and you need help with a plumber or a carpenter. You have no idea how to speak French. Well, you've got a French native who can help you. If you're if you need to go to get your hair cut and it's your first time and you want someone to help explain to the person who's cutting your hair what you want, well, she can, if it's within reach, she can accompany you there. So I think that's a fabulous service. And she and Nicolas are both very humble, typical French, very discret. So they don't know anything about self-promotion or marketing. So that's why I'm mentioning all this. But the rest of the Zoom session will be her talking about what people do towards the end of life. Patricia, it's all yours.
Okay, so thank you very much first for giving me the opportunity, also for your presentation. I'm very discreet, that's right, but I post a lot on Camembert and everywhere on Facebook, so people know my face, I think, and you've seen my name. Anyway, so what I've prepared is a Word document uh, because I went on internet, of course, and I will explain what I found, what Janice asked me to do, like home care, or if you want to go into a nursing home. And then I will talk about my personal experience because my mother was in a nursing home for about 10 years. So I will tell you what I know about this situation. The links, I will post them on the group as well. I will write a post tonight and I will just sum up with all the links. And hopefully I will write them under the video if it works, so you can have a look yourself. So basically, the links are in French, of course, what I found about addresses, so you can always Google or find more. So what I'm going to do is show you the document that I've prepared. So can everybody see? So I like colors. As you see, I've highlighted really important things. So what I just want to say that I'm not an expert about retirement homes. Basically, all the links come from internet. But as I said, my mother was in a EHPAD, actually, because she was dependent at one stage. So I will tell you what I know about that. Depending on where you live, the departments where you live, the benefits or allowances may vary. So I have given on the document as well links to compare the prices to know if you're eligible to some benefits. So I will show you later. Also, so about talking about different departments. First, my mother was in Marseille, so which is department number 13, and then she moved to Avignon to be near my sister, which is in the Vaucluse department number 84. So even if it's just an hour and a half away, I found differences in the benefits we could have at the time. And that's the figures, if you ask me for figures, that's about 10 years ago, where she was in a retirement home in 2012 and she passed away in 2023. So that's a few years. But that will give you an idea about prices anyway. So I said that about the group and the description. So basically, I'm going to talk about 3 points. If you're healthy and if you can live by yourself, or if you want to go to a home and just to be with other people, but you're quite dependent. So you can do that. Then if you're not, well, that's if you're healthy, basically. And then if you are dependent, that's I will explain what the EXPATS are. And then Janice asked me to to talk about funeral arrangements. So I will tell you 2 or 3 things. And so then you can start thinking about what you would like to have and to do. So basically, when I started the research, I've just typed solution hébergement, you know, like housing for elderly people. If you just type that in French, you will have all the solutions. And then you can have a look and start thinking. Obviously, we don't know how we're going to get old. Obviously, we'll be healthy and happy, but you know, just in case, so you know what the solutions are. And then another site, which is a gouv.fr, so which is official. Then you just do pour les personnes âgées, and also that will give you information. So basically, when I started thinking about my presentation, I went to La Mairie, you know, what we call La Mairie annexe. I don't know if you know what it is. Basically, you've got like the city hall, and in each neighborhood, I'm talking about big cities. So there's what we call Mairie annexe. So it's, sorry, just here. Yeah, can you see? Everybody,
Yes.
Mairie annexe.
Yes.
Okay. So if you go there, when I went there and I said, okay, I've got clients, they're getting old, and you know, what are the solutions? She said to go to the CCAS. So it's here. Can you see CCAS?
Yes.
So I think you have to take appointments to go there. But here they've got the Service Social Senior, so for the seniors. And if you want to go to one place, that's the place to go. Because they have a lot of information. They've got flyers, and you can ask information about health, where to go, like nursing home, accommodation. Basically, they will give, you know, I think they're quite competent to give you information about assistance sociale, help with your everyday life, basically. So let me just, apparently there are 2 people, sorry, here and here in the waiting. Okay. I hope everybody is there. Okay. So yeah, the CCAS is the one you can go to and ask. Obviously, I mean, I don't know if they speak English, but then if you have a concern or if you have a question, they will tell you exactly where to go. So that's really the place to go to. And then if you want the list, if you want to know if there is one next to where you live, you can do this site, departments, you know, CCAS, and then you'll have a map of France, and then you can see the nearest CCAS. So it's quite handy. Are you okay so far? Do you want to ask questions, or shall I carry on?
Carry on.
I carry on. Okay. So I haven't mentioned that, but for my mom, for example, we had some benefits because she was handicapped. And also, usually it depends on your income. But if you want to know if you can have some benefits, for example, to pay a third or to help you pay the home or whatever, this is the site Service Public Vos Droits. So here again, you go on that site, and then there will be a calculator, and you can know what you can have if you need, for example. But I just want to insist on something. And there is, I've posted a link at the end of the document about an article, who is going to pay. And you really have to be careful with what they call aide sociale. because what my experience was is at that time my father asked for an aide sociale, so they gave somebody to pay for the home where my mother was. But what we didn't know is when we sold the family home, actually when my father passed away, we had to sell the house to pay for the retirement home for my mom. And what we didn't know is that all the money that they lent us, because my father at the time didn't know it was a loan, we had to reimburse it when we sold the house. So actually, the notaire said you have to pay 32,000 euros. So the money actually was taken out of the succession. So really, you have to be careful. There is an article, and it was written actually, so you really have to read between the lines, I think. But yeah, so really be careful with what they call aide sociale, because they lend you the money.
And they don't tell you you have to pay it back later.
Well, I think at that time my father filled the forms, and I think it must have been written. I don't know, but it was a surprise at the end. But
Wow.
it should be written. I think it is written. So you really have to know that in advance. Okay, another service that maybe you know is France Service. Then it's free. You can go there and they help you with administrative issues about social security. I don't know, if they know all the cases for expats, but France Service is quite good usually with driving license. So maybe, you could go there. And also what I thought is a good exercise to speak French. You go everywhere and you have information everywhere. So, and then, that's an exercise as well. Okay, there is another site about changer autre solution de logement. So they will tell you, about accommodation, just nursing home, or there's quite a lot of places where you can go. For example, what they call résidence autonomie. So there are really various forms of residence autonomy. You can go like in an apartment. You can have like your kitchen. You can cook if you want, or you can share and have lunch and dinner in a dining room. Some have got a restaurant. Actually, I know a new retirement home where they have a nice restaurant and there's a chef cooking for the residents. So yeah, it's quite nice. If you want, you can stay in your apartment, or if you want. So I know actually somebody was renting an apartment, and she was fed up of staying by herself. She said she didn't meet anybody, and she just needed to socialize basically. So she went in one of these in Nice, and she's really happy because she meets people. When she wants to stay by herself, she stays in her apartment where she can have dinner and lunch. But when she wants, she can have, uh, lunch or dinner at the restaurant, and they organize a lot of excursions, and yeah, it's quite nice. Okay, so if you want to find a retirement home, there will be different cases. Some people, if you have Alzheimer, or if there's another site, Trouver Maison de Retraite, Maison de Retraite. So depending on where you live, you'll have the address. So what we've done when we wanted to transfer my mother, we made appointments to visit some places to see where, it would be best for her. So we went there, we asked to have a look at the bedrooms, how many nurses there were, how many doctors, and, the prices. And then sometimes you have to be on a waiting list. So yeah, it depends on your situation, basically. So what we call résidence autonomie, résidence senior, or maison de retraite, like nursing home, there's no medical care. So usually you can, as I said, you have your own apartment, you cook your meals, you can share the meal with other people in the restaurant. So it depends. You know, some people like it, some don't, but it's a solution. Other solutions with prices, this one, so alternatives, you will see when you go on that link, you will find different solutions, as I said. So sometimes they call that residence autonomy, sometimes they call that residence senior. So I suppose it depends on where you live. I can only talk about Nice and what I know, you know, with people who are in that sort of, in this sort of residence. Okay, there's another where you can compare the prices. So that's quite interesting. I think, Janice, you wanted me to say how the bills were for my mother.
Just so we have an idea as compared to, some of us may already know how much it's costing in the US.
Okay,
So
so yeah. So basically, in 2023, we paid 3,000, sorry, 3,000 euros.
per
That
month?
was a month. So it depends if it's 30 or 31 days. And that was everything, actually, the housing, medical care, everything. Basically, she stayed there, 24 hours. So also we chose to have the all her laundry washed because I lived far away and my sister didn't live next to the home. So yeah, that was everything included.
Oh
But
my gosh,
actually,
that was an option.
well, we yeah, we just had to pay for like a shower gel or cream, or sometimes they ask us to go and buy some whatever creams she needed, or yeah.
Huh, okay.
So that was in 2023. And
Thank
she
you.
was I've got to mention, she was in a private home
Ah,
because, well, she needed care and some places didn't accept her because, for example, they didn't have a doctor at night or they didn't have a nurse. So that's also, depending on your case. So she needed something really with medical care in case, she needed care at night, for example. So there were a lot of places that just didn't accept her dossier, basically.
so
Yeah.
are private residences better than public ones?
Well, I thought so, but at the end, when we thought about transferring her, because the price went up, and then at one stage, we wanted, where we were not happy at the end about where she was, so we went to another one which was public, and it was cheaper, actually, cheaper and bigger, and maybe she would have had, I think, better care. I'm not sure. So I just can't compare one where she was and one where we wanted her to go, but because she had to be on a waiting list, and then it was too late to transfer her. So, but we could visit the place, and it was really nice. So
Okay,
then,
but
yeah,
for you, Patricia, let's
yeah,
pretend we're talking about you.
yeah.
If you had to choose between public or private, let's say money is no object, which would you choose for you?
I think public.
Really?
Yeah, yeah. Well, the one I saw is the one we visit with my sister. Is the one in Châteauneuf-du-Pape, and it was in the middle of the vineyard, and it was really nice. So I just went to see one, and I was really impressed by the staff, by the place, by the bedrooms, by everything. So yeah, I think they've got more money from the States. So maybe they can have, I suppose, more space or more medical equipment. I don't know. That's what I've seen anyway.
Hmm.
I
So
I
Yeah,
I imagine that it may just be case by case. I know in the US, some of the public ones are actually better than the nearby private ones. Depends where you live.
yeah. That's why I said it depends really on where you are, because the when she's starting being a bit dependent, she was living in Marseille, and she was in a home in Marseille and they were really nice, and that was private. So yeah, I think the best thing to do is go and see the place first of all, and ask about the price and what they can offer, about activities, and they've got a lot of things now, you know. So then, yeah, it would be reassuring to be able to go first and decide where you want to go, and not to have somebody decide for you, I suppose.
So, Patricia, is
Yeah.
that something you've done for you?
For me, no, I haven't actually. I wouldn't like to go into these places actually, but I don't know if I've got the choice. I'll have to. I've got my children who would decide, and hopefully, yeah. Okay, so the EHPAD, which are for dependents, I've read, I think, yesterday that you have to be 60 years old, and you need care basically for everyday life. So that's if you go to a place called EHPAD. But what you could do as well, you could stay at home and have people coming, and nurses and looking after you if you don't want to go to an EHPAD, for example. And that's what they call auxiliaire de vie. So I know a couple actually, that first of all they can't afford to go to an EHPAD because it's quite expensive if you're two, of course. So they stay at home, and they've got somebody who stay at night and also with them. And during the day, they've got people, washing them and cooking for them and everything. But that has a cost as well. So,
So,
and it's
Patricia,
just, yeah.
could you just say that again, what that service is called?
It's
When,
here, auxiliaire de vie. Can you see it?
oh,
I'm going
actually,
to
hang on.
highlight.
I gotta change
I'm
my
going to,
view.
okay. I'm going to highlight it.
Yes,
Auxiliaire de vie. Yeah,
thank you.
you're welcome.
So Patricia,
Yeah,
the pad, is that what your mother was in when she
yeah,
needed the care? Okay.
yes. Yeah, she was dependent. She was on a wheelchair. She couldn't sort of eat by herself. She couldn't move, and she couldn't wash, and she couldn't do anything. So she needed, and at one stage, my sister, who has a big house, thought that she could take my mother at home and have people coming for everything. But then I wasn't really keen on that. I think you have to trust people who come and look after you. And also, we thought if one day the nurse is sick, she cannot come, and then it's running, it's managing staff basically.
Mhm.
5 or 6 people coming to your place, and my sister wasn't there all the time, so
Mm.
you know
Good point. You're
yeah,
managing all those people. Yeah.
yeah, exactly. So at least in the home there's always a nurse or two, or there's always somebody at night, and so it was reassuring.
Mm.
So yeah, you said private, public. That's what I said. It depends on where you live, and usually public, they've got more subsidies from the state. So it depends. Yeah.
Mhm.
Okay, and so here I've posted links about uh, the what I've said, aide sociale. Okay, remboursement. So if you have to refund, so there's an article here in French, but I suppose you can Google it to translate. And then qui doit payer? So who is going to pay for the retirement home? So obviously, if you can afford paying for it, then there's no problem. Otherwise, what people do, sometimes they sell their house and they can pay for the home with the money they get.
And Patricia, the 3,000 a month, that was for the EPAD.
Yeah.
Yeah.
Mm.
That's incredibly reasonable compared to US prices.
I know. Jenny said it was
It's
like
shocking.
6,000.
I'm just, shocking.
Okay, funeral arrangements. I don't know what to say about that, but I know that if you want to plan or anticipate about how you want things to be managed, in France, I know that you can anticipate and pay for what they call contrat obsèque. Obsèque is the funeral, or plan obsèque. So it depends on who is dealing with it. You can ask your bank, you can ask your insurance company, or you can go to a funeral home. And I think for like sometimes 15 to 20 euros a month for I don't know how many years, but then you can plan everything in advance. So that's quite reassuring. And then so you don't have to wonder who is going to pay and that sort of things, all the details. So I know that some people do that. And then if you can still go and ask them if you go to a funeral home, and they are everywhere. I think there's quite a lot everywhere. But on internet, you just ask for pompe funèbre autour de moi, and they will tell you, depending on where you live, again. So they will explain, and then you can say, you can plan exactly what you want.
Patricia,
Yeah.
I have a question. Sorry,
Sure.
I joined slightly late, so
yeah, no problem.
we may have covered this. But I'm curious, in the US, if a person is unable to do things for themselves, like maybe they've got the money for care at home or care in a private facility, but they've got Alzheimer's or have had a stroke and cannot themselves like make sure the bills are being paid. That type of thing, where we can have a guardian, someone called a guardian assigned to help us with those things. I'm wondering if that's something we can find in France, and like, would we talk to our notaire about it, or would we talk to the CCIS to try to find help that way?
Yeah.
Do you know?
Well, I've got to try to remember. We did that for my mom because at one stage she couldn't run a bank account and she couldn't do anything. She didn't remember anything. So it was like a power of attorney. I think you
Mm-hmm.
yeah. And then we went to a judge. Actually, we asked.
Okay.
Yeah. And then first they decided that it would be my sister. Because she was near her, and then after a while it was me, so I was
yeah I don't have kids, so I'm thinking I might have to hire a professional, but maybe I could talk to a notaire to start.
Notaire or assitante sociale, they will tell you.
Okay, great. Thank you.
They will tell you exactly.
Patricia, I see that you're at the end of your document. Are you now opening it up to questions?
Yeah, sure. Yeah, I've finished basically.
Oh,
yeah.
Okay.
Sorry.
Here's my first question.
Yeah.
Most of the people in the club probably could not handle speaking French if they were living on their own and living surrounded by only French speakers. How necessary is it for these people? What level of French would they need to really be able to survive living in an EHPAD?
unless people at the EXPAT speak English, because you've got young people working there, and you know sometimes they speak English. Well, I would say at least A2. That's just to say what you like, what you don't like, how you feel. You know, if you have like a stomachache or a headache or something, just to describe.
Yeah. But what if
the-
they want to say something like, the neighbor next door makes too much noise at night and I can't sleep? You know, that requires a little bit more than A2, right?
Well, you can just speak without making sentences, like, you know, noise, and you have
Yeah.
signs, and
Yeah.
obviously, I mean, I
But
think
if they have no one to speak to during the day, if all of the daytime activities provided at the nursing home are French, if they're singing French songs, if they're a exercise class where they're being told to raise their hands and clap and get up,
yeah,
you need more than A2 French for that.
yeah, but then you would copy what the others do. You know, like if they say raise your hand, you raise your hand. I mean, they're not like, it's not high level classes, or yeah. Well, I mean, obviously, if you have B1 or B2, that's the ideal situation. And also when you go to the doctor and you have to speak French, yeah, I think that's, you cannot do without, I suppose.
Yeah.
I would not be surprised, given the number of Brits that are in southwestern France, in the Dordogne, as they call it, La Dordogne.
Yeah.
I would not be surprised if there are British-speaking or English-speaking retirement homes in that part of the country.
I think there's one here, somewhere around here too.
Okay.
I think I've heard of one.
So probably just Google English-speaking EXPAT.
Yes,
EXPAT.
probably. I haven't thought of that, you know, but yeah, of course.
So
Yes.
there definitely are some English speaking ones, but my concern would be that you might not be able to get in because of limited capacity. So, I mean, I personally would be afraid to be an older person living in France without an intermediate level of language ability.
Of
I
course.
think, you know, it's nice to have French friends. It's nice to be able to talk to your doctor at a little higher level.
Of course.
Yeah.
Yeah. Well, that's something to think about. I mean, I think people will feel isolated even more when you don't speak the language.
Yeah.
That's for sure. That's if you are aware of what is happening around you. But if you're not, it doesn't matter if you speak English or French.
Yeah, that's
True.
That's
Yeah.
true.
Patricia, I have
Yeah.
a question for you about one of the first things you mentioned,
Yeah.
going to the CCAS.
Yeah.
CCAS.
Yeah.
We went to ours here in Antibes, and we were surprised and delighted to find out that every single senior in the town already has a social worker. They just divide up Antibes into sectors, and there's one social worker for each sector. So they gave us, we walked in and they had us meet our social worker. And we were able to ask her some questions, and she explained the process to us. And I wonder, is it the same everywhere in France?
Well, I mean, the one I've been to, no, I went to the Mairie annexe in Nice, the really small ones. But I know that they can be very nice, and they have a lot of solutions. So you just go. And did you speak English?
No.
Or French? Yeah. Okay. But I'm sure in Antibes they've got staff who speak English, don't they?
Like,
Yeah, probably.
Mark, when you went to your CCAS, did you ask them any questions as far as financial responsibilities? If you and your wife don't have the money needed, at what point can France go after your children in the US?
I don't remember at what point.
I don't, it's like if we can't, before the French government would chip in, they would tap our kids to pay for a nursing home. And it didn't matter that our kids are all in the United States.
They will find them.
They will find them, they will call them in, they will interview them to see what they feel like their financial, their ability to help pay for that would be. That was a surprise for us, and so we had a conversation with our kids about it. Because of course it's different in the US. You spend down and then you go on Medicaid. But
If it still exists.
yeah, well, anyway. I have another related question. I don't know, does that address whatever question was asked there?
I'm good.
In the same vein, one thing that I wondered about, and I wonder if you know about, the whole, I think in English we call it a reverse mortgage, but the viager, as a source of income, where you sell your apartment, but you get to keep living in it. Say if one person were to go into a nursing home and the other still wanted to live in the apartment, or home or whatever, you can sell it as a viager, and then you get a monthly income for as long as you live.
From the buyer.
From the buyer. Now, if a second person goes in the nursing home, then I don't know what happens. So I don't, if you know about anything about that.
A notaire will tell you, I suppose, if you go and ask for an appointment and you give your situation, and a notaire will tell you exactly what happens. Yeah. But regarding the aide sociale and the children, before my mom passed away, with my sister, we wanted to ask for aide sociale again. And then when we looked on internet, we had to give our children's salaries, so our incomes and our children's incomes, just in case we couldn't pay, our children would have had to pay.
So the grandchildren of the person in the nursing home are also financially liable.
Yeah. So we didn't ask. We thought it was a bit unfair for our children, to have this responsibility for that. Yeah.
Wow.
So Patricia, there is no real aide sociale. You have to basically pay for your own upkeep in a nursing home.
Yeah, for the aide sociale. But for example, for my mom, she had a pension, then she had allowance for handicapped people. So then, everything added up, and then they took the rest from the bank accounts with the sale of the house. So,
okay, but Americans aren't going to have a pension for the most part. And let's imagine they don't have any sort of allowance for a handicap. We are 100% responsible for our own costs in a nursing home.
That's something that you would have to ask, I suppose, a notaire, or or if you go to a retirement home and you explain your situation.
Yeah.
Where would they get the money, and they will tell you. I'm
okay.
Sure. Yeah.
So I didn't get a chance to ask you rough costs on funeral arrangements. Rough.
Well, it depends what people want, but between 2,000 and 3,000 euros.
That's nothing. That's
that's so cheap.
That for cremation?
Yeah, it could be.
Okay, so the 2,000 or 3,000, what did that actually cover in your case?
Well, like cremation and dealing with all the papers and like the flowers and transferring from the hospital to the place, everything.
A room to receive people, mourners?
Yeah.
Oh, wow. Okay. I didn't believe
that. Yeah. Well, for you it's cheap. For us it is expensive, but yeah.
I wanted to ask you, Patricia, if you had a chance to, if you're familiar with this book, Les
Fossoyeurs, no.
It came out 2 years ago, about the time your mom was passing away.
Okay.
And this is a journalist who wrote an in-depth examination of French nursing homes of all sorts.
Oh, really?
And, yeah, it's a long book. It's
I got to borrow that from you.
Yeah.
I'm not super. After you return the last one, Janet. I'm kidding.
It's like a library.
But it's this got a lot of coverage in the media on the French news, and I'm only a part of the way into it. But he starts out by discussing the fanciest, highest class, richest, nicest, poshest nursing home in all of France, and it's like one of the worst ones. So, I mean, all kinds of abuse, deception, like they pretend to have more staff than they actually have.
Oh,
And so it makes you say, good grief, I have to be careful. So I would recommend this.
wow.
Yeah.
Yeah.
There've been quite a lot of scandals about places, you know. I mean, I think it's coming up now. But yeah, about people like the staff abusing and the elderly people, and yeah, that's quite awful actually.
And that started a whole investigation.
Yeah.
What I wanted to make was that just because a place is expensive and has lots of rich people there, that doesn't mean they're getting the best care.
Wow.
And we visited a public Red Cross EXPAT across the street from us, and we were very impressed. It looks great, and that's where I would plan to go if I needed that. And so this is
just to know.
public service. I'm offering this.
Yeah, I know it's quite scary actually.
Thanks, Mark.
When you hear horror stories about these places, they take the money of people and then
I wonder if, Mark, if it's has to do with them being private too. I wonder if, you know, there's
this one was, yes.
Yeah, I wonder if the private ones, you know, they may be expensive and fancy, but maybe they don't have oversight or certain regulations that the public ones do. So, you know, you're more to, you know, trust.
Yeah. I think as Americans, we would tend to think the private one is certainly going to be the best.
Yeah.
And the most reliable. And I found out,
yeah. Interesting. Do we have anyone else in the audience who has real life experience with parent or in-laws in France at the end of their lives that would maybe have some nuggets of information to share with us? Betsy, you're on mute. Betsy, if you're talking, you're on mute.
There we go. Okay. Well, since you know I have, we had both my father-in-law and then my mother-in-law. And this was a half public, half private EXPAT in Burgundy, in the countryside. It was owned half by the state and half by the doctors. It was excellent, absolutely excellent. My mother-in-law was in the Alzheimer's unit for 3 years, and the staff was behind a locked door. The staff was really quite good. There's one, what we would call in the States a registered nurse, but that's the same in all nursing homes in the States. I've seen 4 parents through this system, 2 in the States and 2 in France. So in the States also, all of the nursing homes are assisted living, etc. They only have 1 nurse on duty. Everybody else is a practical nurse. Or they're just nursing assistants. And it's the same in France, but in France, they're very, very well trained. The cook was wonderful. I remember going to a birthday celebration and the whipped cream icing on the cake was just to die for.
Yeah.
Everything is, but that was the same when my children were in a crèche here in France. There was a cook and they made their own yogurt in the crèche, the same thing. So the food was good, the programming was good. And we saw that she went through the system sort of in a cohort. Those who arrived around the same time were all just really checking out at about the same about the same pace. And that at that point, when there really was nothing more to do, no more, the songs, she'd just sit there with a blank stare during the songs. At that point, there was another service upstairs where they were cared for, but there was no more programming. And then finally, she just died. And my father-in-law was the same thing with Parkinson's. He was in the same EPAD and very well taken care of. The doctor came a couple of times a week. And
Wow.
yeah, but there was always the same odor, and there's no carpeting. I mean, the floors are washed, whereas in the States, all the places all had carpeting. And you always kind of wonder, like, oh, what is in that carpeting? So,
Betsy, can you talk about
That
cost,
never cost no
and
money.
not just cost of the institutions, but costs of the children and grandchildren of the people in those institutions?
well, my father-in-law was really savvy. I mean, he was a manual worker, but he signed up for every retirement program he could. So there was never any need for outside costs. I mean, it was about 3,000 a month. Let's see, my mother-in-law's been gone for about 14 years now, I think. Yeah, 13, 14 years. And it was about 3,000 a month in a full Alzheimer's unit. Some people in there had state help. Not everybody was as lucky as my mother-in-law. That my father-in-law left her in very good in shape. She had already signed the house over to my husband and my sister-in-law. So that wasn't, she couldn't sell the house to pay for it. She had already signed it over. It already belonged to my husband and his sister. But the cost was about 3,000. Now, my mother, her last 2 months, I had to put her into a place with a locked door. And it was Alzheimer's, a memory, but she was not Alzheimer's. And you could see the difference in the energy level. And that I wanted a private room for her, so I ended up paying 7,000 a month for those last 2 months.
Okay, but that was in the US.
That was in the US. Yeah.
Okay, let's just confine our discussion to France.
Okay.
So your French in-laws planned it so that they could always afford to pay for their own upkeep. So they never asked the children, and the state never asked the children, the state never asked the grandchildren to chip in, because they were essentially self-sufficient in their planning.
They were, even though he was a manual worker and she was just an office clerk. He had signed up for every retirement program there was through his union or through his, every supplemental retirement. So she had about a 3,000 some income per month, which was really, 2000, 2010, 2015, this was really quite a good income for somebody living retired to a village in France. Patricia, wouldn't you agree with that?
Yeah, I think so. And also, I think that if you have an apartment or a house that you sell, that is quite a solution to pay for example, the, if you stay in a home.
Yeah. So no, they never had to ask for any help anywhere. We were never approached by it. There was enough income every month, thanks to all these supplemental retirements, in addition to their pension that they had. Yeah.
Betsy, your in-laws here in France, did they speak French?
Well, they were born in the wool French people. Yeah.
Okay, they were French, yeah.
Yeah, the furthest they would travel maybe was to see cousins, in Brittany or something. Yeah.
Okay.
Okay. Yeah.
So Betsy, do you have a sense of how important it is to speak French by the time you're in a nursing home and what level you really need to be comfortable with your other patients as friends, speaking with staff?
Well, as you move along, you become more and more self-isolate. There's a self-isolation that goes on too. So if you have this outside handicap, it's going to make it even worse. Like the dining tables are not full of brilliant conversation in no matter what country you're in. And and as that goes along, the rooms become quieter and quieter. Sometimes the staff will sit at the table and ask questions, and try to keep things up. Or the person will be telling the same stories. Your neighbor will be telling the same stories all again. But when you're in the medicalized sections, people become more and more isolated, and that's a self-isolation. So if you can't really respond to your neighbors, no matter what sort of inanity they're saying to you, you're more and more isolated, and you have pain, and I think it would be difficult. The other thing that bothers me is, I still have a pretty heavy accent even after 50 years. So is that, the hearing's going to go. At some point, the hearing's going to get worse and worse. So you have to add that onto it also. You might have a neighbor at your table trying to tell you a story, but you can't quite hear them, on top of not knowing the language very well.
Good point. Okay, so Betsy, you've had experience with both sides of your family, in-laws and your parents.
Yeah.
You have experience both in the US and both in France.
Yeah.
You personally, where do you want to go? When you're
Definitely France.
Definitely France.
Oh yeah, I think there's much more. Well, I mean, what Mark brought up about that I think that was an EPAD in the 16th that they,
Yeah.
that was, yeah. But the ones where my only experiences with this public-private partnership EPAD in Burgundy, and those staff members are so well trained. I mean, in France that you don't do anything without your certificate de this or that. And it entails months, if not years, of training to do the most, job. Do you have your certificate in salesmanship before we'll allow you to sell clothes in the store? It's and that's how it is. I mean, the people are really well trained. And even, and if they're going to complain, there are channels for complaining, but people get vacations. I mean, you're not living in the same pressure cooker, even when you're working. So a poor, in the States, the people working in these places are making what, 10, 15, and they are not making enough to survive, really. The people who are taking care of you. So, although the palliative care, hospice, that's a wonderful program, but even that, I realize that it's all for-profit companies, cashing in on Medicare, paying for the end of life, So when I signed them into hospice, which hospice do I want to use? Well, that just means that it's a company who sends people to give my mother a massage or to do other stuff, with her. She just gets much more care, much more attention, and a big company. Some company is making money off of it from Medicare.
That's the American way.
That's the American way. Yeah, the for-profit medicine. So, and the people working in those places at the higher levels, when you talk to them, they say, oh, it's a calling, because you wonder how can they work in these places? And they say, oh, it's a calling. And, in France, I think, I'm not sure how well the people working, doing the hard labor every day of lifting the patients and putting them in the wheelchairs. I'm not sure how well they're trained in the States, what those programs are, but you do know in France that they're well trained. So
I know that when I worked for 2 summers at a nursing home as an orderly, I was trained on the job as needed.
there
And
you go.
the training I had ahead of time was selling Baskin Robbins ice cream.
Yeah,
And
yeah.
but I was conscientious. And I said, this could be me someday with the roles reversed. And so,
Well,
but,
yeah, and that's fine when you're young and you don't have
Yeah.
kids and you're not worried about your bills and, et cetera, et cetera.
Yeah.
Um, and you're, so I think in France, they are working a 35-hour week. They have vacation. It's a career.
Yeah.
and they have good health coverage.
It's a career,
Yeah, yeah. Yeah. Patricia, what do you think?
I agree with you.
Thank you.
Now,
I mean,
but
there are no bells and whistles. I mean, you're missing
Of
some of
course.
the bells and whistles. You're not going to have a chandelier in the dining room.
mind
But
you, when my mother was in the Marseille area, they had a nice country house with a nice garden, and it was really nice. It just reminded me of Pagnol books, that was really nice. Yeah,
oh, please,
lovely.
can you send me the name?
Yeah, sure.
I'm in Montpellier.
Okay, I have to remember, but yeah, that was lovely. I loved going there, and the staff was really nice. What happens now, because it's really hard, as you said, to leave patients, and it's really, sometimes there's a lack of staff now, a shortage of
Yeah.
staff, and that's why we found the last one. She was in Avignon. At the end, we were not really happy with the service because there was not enough people. So yeah, that's why we wanted to transfer my mom to another place.
Yeah.
And still young people. I was wondering if they were quite nice, all of them, even if the work was really hard. As you said, it's a calling. You mean that's a vocation? That's
Yeah.
what yeah.
Yeah, well,
it
actually, it's a calling means my reward is the goodness I feel helping others.
Yeah.
It's not going to be a financial reward. It's I'm rewarded other ways.
Yeah.
It's a calling, like being a priest. It's a calling.
Yeah.
So
Okay, so it's been 1 hour. If anyone needs to leave, I think
We had somebody, Laura, I think she left.
Yeah.
She left
so
a
I want to
note.
thank Patricia. I'm going to
Thank
stay
you.
on so we can chit chat. I'm very curious to see what other people have ideas about. But
Okay, sure.
maybe we should stop the recording at this point, Patricia, because you've covered all the good points.
Okay, so let me find